So you've heard in the morning a lot of the epidemiology about this. You've heard the national and local data. You've heard about what's been happening and in Connecticut. You've heard some really, really interesting, innovative ideas of what can be done through technology and online. And now you're going to hear more about specific effective behavioral interventions for men who have sex with men, gay men, bisexual men. The way this is set up, first Gina D'Angelo from the Department of Public Health is going to talk about selecting effective behavioral interventions. And then she will provide a little bit of an overview for each of the interventions that we're going to be talking about, from a theoretical perspective, the core elements of that intervention, sort of some of the science behind the intervention. And then you're going to hear from people who have experience on the ground level implementing these interventions. So on that note, welcome Gina D'Angelo.
And I'm short, so the mic goes down. Okay, so on that note, we are going to spend the majority of this afternoon really starting to look at what some of these effective interventions are. But prior to doing that and to delving into the specific interventions, we wanted to give you some things to think about, especially for people out there who are doing the work with MSM, to think about, well, how do you even go about choosing or selecting an intervention that is right for you? And so we are specifically talking about selecting for men who have sex with men, but it does apply to all the other populations that you work with as well. So just for anyone in the room who is not fully up on what behavioral interventions are, you know, we're talking about interventions or intervening in such a way that we're looking at changing people's behavior. And the interventions, the way that they do that is they actually try to influence behavioral determinants. And a behavioral determinant is something that actually makes people act or behave in the way that they do. And a lot of times the interventions are trying to change people's knowledge. Sometimes it's their attitudes. Sometimes it's the skills that they have around protecting themselves or not protecting themselves. And so those are the things that we're trying to affect change on. The CDC has identified 69 effective behavioral interventions. And what that means is they've been rigorously studied through research and have been proven effective at changing behavior. And if you look at the actual research studies, they've really changed behavior significantly. We're talking about significant decreases in risky behavior. We're talking about significant increases in condom use, and all they have to show all positive outcomes in order to be considered effective. So those are the EBIs, the effective behavioral interventions. We call them dearly EBIs. And then a lot of you may have heard about DEBI. And basically DEBI, that's just a term for diffusing or getting the interventions out into the community. So CDC created something called the DEBI Project. They took 26 of their 69 interventions and stuck them in the DEBI Project. And what the DEBI Project did was they just packaged them into user-friendly kits that organizations like, you know, some of you that are here today could just take and implement really easily. And they also come with training and with capacity building and technical assistance for people who want to use them as well. So choosing an EBI or a DEBI, which best matches not only your community but your agency, is more likely to be effective in the real world and to work at affecting behavior change. So how do we go about selecting an intervention? Really, we would like people to think about answering two questions. The first, is this the best intervention for my target population? And the second is, does your agency or yourself have the resources to not only implement the intervention, but to maintain it over time? So how do we get those answers? Well, there are 5 simple steps to selecting an intervention. The first being a community assessment, and I'm going to talk about that in a minute because there's lots of different community assessments. There's large scale, there's small scale. So what are we really talking about? What do you have to do when you're looking to select an intervention? Choosing your target population and your risk behavior, you know, in this case, we're talking about gay men and other men who have sex with men today, but whatever your target population is examining the interventions for the chosen population and really getting to know what they are, what makes them tick, to have a good understanding as to whether or not you can do them. And that leads into your assessing your own capacity, which is your ability to be able to actually do them. And then selecting a matching intervention, which means you want to have a good fit between does the intervention work for the community and does it work for our agency. So if we go back to step one, that community assessment process, you're really looking at assessing the community's HIV prevention needs through observations and interviews, very minor data collection, which pretty much means, look at the data that your surveillance, the DPH surveillance already has. Look at some data and information that's been collected through your community planning group's needs assessments. That's the kind of data that you could use to back up your case. But what we're really looking at when we talk about community assessment to select an intervention is get to know the community. Get out of your office, go out to where people are. Now, when we're talking about gay men and men who have sex with men, we're talking about the bookstores here in Connecticut. And let me just tell you, I had the most eye-opening experience of my life going to an adult bookstore at 12 o'clock noon on a work day. One of the best trainings I ever went to was for an intervention called Community Promise. And my colleagues are probably really sick of hearing this story, but it really impacted me after having worked in this field for so long to be thrust into this situation where you're forced to look and see what's going on. I mean, at this adult bookstore, there were men of every race, age, social status, going in and out of there like a revolving door. And another place that they sent us, which was really interesting, was Bushnell Park in Hartford. And you would think, God, what are you going to look and see happening there? Oh, my God. We had conversations with the garbage men about where they were picking up the condoms. The vendors that sell food, talk to them. They could tell you when the cars come around, pick up the young men, and when they drop them back off. So there's so much you can learn by just going out and putting your finger on the pulse of a community. So you got to find out what's the population, but not just the population, what's the subpopulation? There's a lot of diversity within a group of gay men or a group of men who have sex with men. So you might be looking at men who have sex with men that are young black MSM. So you have to really think about who's out there, what are they doing that's putting them at risk, what are those specific risk behaviors that you want to change, and what are their specific needs. So I kind of went over some of this, but community assessment means going out to those bars, cruising areas, parties, bookstores, mapping out the activity. They actually had us draw a picture when we went of the park and put on there what we were seeing and when things were happening. Finding out about the activity, where it's happening and when and how. Interviewing people that see the activity, like those garbage men and those vendors, but also interviewing people who work with them. So that means collaborating with other folks that see the same people. And talking to people who are a member of the community itself. So it's all an effort to get closer to that core group. What community assessment in this sense of the word does not really mean is you don't have to do a lot of data collection. You don't have to conduct a big old needs assessment. You don't have to spend a lot of time, money, or resources just to go out and try to do some good information gathering about your target population. So step 2, based on whatever you find out in that community assessment, is to choose your population and your behavior to target. What is the main target population, the subpopulation, who and what behavior are you specifically looking to target? I think I went through all that. So once you know the pop and the target, the risk behavior, you really need to start examining the interventions and for a good fit. Which ones specifically target your populations are very geared for specific things. And there's information on the EBIs, on the CDC website, one-page fact sheets that you can assess. And there's information on the DEBIs at effectiveinterventions.org, and pretty comprehensive stuff. So once you've chosen the EBI, then you need to say, hey, can our agency really do this? And start looking at your capacity. And what capacity really means is, do we have the ability? Do we have the right staff? This is such a key thing. You have to have a staff person that has the ability to go out and socially reach the people that you need them to reach. Do they have the right expertise? Funding, a lot of times we hear from people, is an issue. We've got funding. Please apply for it. people are not applying to do work with this population in Connecticut for some reason. We need people to apply. Materials, can you get a hold of them? There's some of the EBBs that online, when you look at it, it says the materials aren't really available. You got to make sure that you can get them. Or you may have to call somebody to get them. And then finally, does the agency have the ability to not only implement, but as I said, sustain the intervention over time? The great thing about the Debbie website is they have agency readiness tools. So you could kind of do like a self-quiz and find out if your agency actually has what it takes to implement. And then you're going to select your intervention based on the community assessment, the assessment of your own agency, what's the best fit here, and then go ahead and create that detailed implementation plan and propose an intervention, and then prepare your agency to implement and maintain it over time. So interventions in the community, basically we're looking for organizations to propose working with the population, but take everything into account. Take into account the data from your surveillance unit, take into account the priority populations from your planning group, identify the populations that you want to reach, but also be prepared to demonstrate the need for them to have the service. And don't forget that you should really think about doing an updated community-type assessment on an ongoing basis with all your populations, because things change, and people don't always stay where they were before, and people don't always act the same way they did before. DPH's role, we put out a request for proposals every 3 years for prevention services, and we do base that on the community planning group recommendations of what populations and what interventions should be looked at. We do support the use of evidence-based interventions for all populations, including MSM and gay men. We have staff that are assigned as intervention specialists to oversee each intervention that we fund. And then they can also identify capacity building assistance needs for people and training needs. So our future goals: continue to fund appropriate science-based prevention interventions for all of our populations, including MSM. A lot of people for years have said, why do we only do Debbies and Ebbies? Well, number one, that's what CDC pays us to do. But number two, they're cost effective. The extensive research on them has already been done. So they're easy to replicate, they're easy to monitor. And they've been researched and to be culturally appropriate, which is really important. And then we need to ensure that target populations identified are a high priority. Ensure that our chosen interventions are those that will have the greatest impact, because resources are scarce. And we need to make sure, most importantly, I think, that there are more interventions available for MSM and gay men within the state of Connecticut. Okay, so our immediate next steps is our community planning group is right now in the priority setting process to rank target populations in need of prevention services. DPH will be going out sometime around the fall of 2010 for prevention services, and then we'll be hoping to have more organizations responding. There are your effectiveinterventions.org website and your DPH website if you want to know what's funded now.